inflammation, as you know, that it is a combination of 4 to 5 cardinal features like color, dolor, rubor, tumor, and loss of function. That means increase in temperature, redness, pain, swelling, and loss of function to a localized part or in general whole system. Okay, so mediators of acute inflammation, from the name, it is very much evident that the acute inflammation is mediated by few chemicals. Okay, and it is a entirely chemical reaction. Rather, it is better to say this is a chain reaction involving innumerous chemicals. Okay, why I call it a chain reaction? Because in chain reaction, from the knowledge of our physics days, we know that chain reaction is one reaction, the substrate and the output or the product of a reaction that is used as a substrate of the next reaction, and so the vicious cycle going on. Okay, the same thing happens in acute inflammation also. The interleukins, the cytokines, the chemokines that will utter later, okay, these all activated and they reactivated the second molecule. The second molecule, they reactivates or promotes the release of third molecule. So the vicious cycle of the reaction, chemical reaction, chain reaction is going on. Okay, so the chemical mediators of acute inflammation, or simply the mediators of acute inflammation, is broadly classified into two categories. Okay, one is cell-derived mediator, another is plasma-derived mediator. Okay, so cell-derived mediator, from the name, it is evident that the mediators come from the cell. Okay, so the cellular component of our body that gives rise to release of few chemicals. Okay, those are called as cell-derived mediator, and the smaller amount is being contributed by the plasma, like kinin system, coagulation system, complement system. Okay, so these are lesser in number than that of cell-derived mediator. Okay, and these are plasma-derived. So the least liver is the metabolic factory of our body. Taito. So among the cell-derived mediator, there are also a sub-classification. The sub-classification is mediators that are released from preformed granules, and the mediator next is mediator that are being synthesized de novo at the time of inflammation. Okay, so preformed mediator in secretory granules, the classic examples are histamine and serotonin. Their source is mast cell, basophil, and platelets respectively. Okay, and among the newly synthesized mediators, newly synthesized means at the time of inflammation, at the time of leukocyte activation, or at the time of insult to the tissue or tissue damage, these mediators are being synthesized by the cell. Okay, and these are very much important, and their important examples are prostaglandins, leukotrienes, platelet activating factor, reactive oxygen species, nitric oxide, cytokines, neuropeptide, etc. And their sources are all leukocytes are sources, mast cell, endothelial cells, macrophages, okay, nerve fibers is the source of neuropeptide. So the mediators that derive from the cell are subclassified into two categories. One is preformed granules released from preformed. So the list of cell-derived mediator is more than that of plasma-derived mediator, and the sources of cell-derived mediator are mast cell, source of histamine, serotonin, okay, platelets, etc. So one by one we will describe the functions of individual mediators and their effects. Okay. So from the cardinal features of our inflammation, it is evident that few important action of the tissue and the few important changes in our body that leads to the entire process of inflammation, like vasoconstriction, like vasodilatation, like increase in vascular permeability, pain, fever, etc. Okay, and the single effect has been contributed by multiple number of mediators. So this is a converging effect. Okay, so multiple mediator, mediator A, mediator 2, mediator 3, all are involved in vasodilatation. Vasodilatation is the most important initial event of inflammation. Okay, so what are the potent vasodilator? Prostaglandins, nitric oxide and histamines. Okay, vasodilator, nitric oxide. Next function is increased vascular permeability, and the responsible molecules are histamine, serotonin, C3A and C5A. These are complement derived mediators. C4, D4, E4, platelet activation factor, substance P. So these number of molecules, they converge their effect to increase the vascular permeability. Next is leukocyte recruitment and activation, and the responsible mediators are TNF, that is tumor necrosis factor, interleukin 1, chemokines again is leukotriene, and C3A and 5A. C3A. Next is pain. So prostaglandin, bradykinin and neuropeptides or substance P, these are responsible for causing of pain, and tissue damage is mediated by various leukocyte enzymes or lysosomal enzyme as well as reactive oxygen species. So reactive oxygen species are very much important free radical mediated injury in our tissue or body environment. So among the derived mediator, the first and foremost and the most ancient to be discovered, that is histamine and serotonin. So what are their source? Basophil, mast cell, histamine. So basophil has or mast cell has IgE receptor on their surface. On the exposure of the allergen, okay, this IgE being activated and they attach to the specified ligand or receptor surface of the basophil or mast cell, and there is antigen antibody reactions occur, and the type of antibody antigen reaction is type 1, okay, IgE mediated, and after the reaction what occurs? Degranulation of the basophil or mast cell. Degranulation means there are certain specialized granules free from granules in the cytoplasm of the basophil and mast cell. Okay, so after the attachment of IgE, immunoglobulin E, to the specified receptor, these granules are being releasing their content to the exterior, and the release of content from intracellular vesicle to exterior means, what does it called? Exocytosis. Okay, so degranulation and exocytosis of the basophil or mast cell occur, and then histamine, platelet activating factor, leukotriene and other mediators, they are being released from the basophil. Next is cytokines, namely interleukin 1, TNF for tumor necrosis factor, and chemokines. Okay, so cytokine has the most powerful and most member containing list, most vigorous list. Okay, there are so many number of interleukin. Okay, and they have variety of functions. Okay, not only in inflammation, but they also take part in hematopoiesis or formation of blood elements in bone marrow. Okay, so here our focus is only those interleukin and those cytokines, those are involved in acute inflammation. Okay, those are interleukin 1, interleukin 2, interleukin 3 to interleukin 6. Next, interferon alpha, interferon beta, and interferon gamma. Okay, and these are GCSF, GMCSF. These are colony stimulating factor of granulocyte and macrophage. So these are not involved in acute inflammation. These are involved in hematopoiesis. So what are the functions of interleukin? They are being secreted by the individual cells, like namely leukocyte or macrophages. Then the cytokine that initiates the signal peptide or signal protein transduction, and non-specific depends and effects on various cell types. So cytokines is the perfect examples of chemical reaction. One cytokine that being released after initiation of inflammation from leukocyte or macrophage, that interleukin or that cytokine, they are very motivating effect of release of another 2-3 cytokines or interleukins in the vicinity. Okay, everybody clear up to this? So this interleukin 1 and tumor necrosis factor, the most important interleukins in acute inflammation, they have variety of effects. What are those effects? No inflammation will be completed without the involvement of endothelial cells. So endothelial cells is very much important for mediating acute inflammation. So bacterial products, immune complexes, toxins, physical injury, and other cytokines as a part of chain reaction, they motivates to release the activation of macrophage and secretion of tumor necrosis factor or interleukin 1, they being secreted. So tumor necrosis factor and interleukin 1 are most potent chemokines or interleukins in acute inflammation. Okay, apart from the previous long list. So what are their endothelial effect? Leukocyte adherence, prostacyclin synthesis, procoagulant activity increases, and decrease of anticoagulant activity. So endothelia, what is the function of endothelium? In inflammation, whenever endothelium or endothelial cell is damaged, there is stasis of blood. Okay, stasis of blood due to slowing of the blood in the flowing lumen. There is a break in the wall in the lumen, so there is slowing down or stasis of the normal blood flow, and there is a chance of increased coagulation and decreased anticoagulation. So whenever the blood is being slowed down, then the procoagulant factor or the factors those are involved to make a clot, make a blood clot or make a thrombosis, those mediators or those chemical, they take the upper hand. They take the upper hand in comparison with the anticoagulant molecules or anticoagulant mechanism. Okay, so endothelial effect in acute inflammation, it increases the procoagulant activity and decreases the anticoagulant activity. We'll all discuss this later in the in the slides of eicosanoids or arachidonic acid metabolites. Okay, what are the systemic effects? Fever, increased sleep, decreased appetite, increased acute phase protein, and hemodynamic effects or shock. Neutrophilia, that is neutrophilic leukocytosis in blood picture or CBC. So decreased appetite is mediated by tumor necrosis factor. Tumor necrosis factor. So this interleukin is have an important function in anorexia. So in case of cancer, patients are often cachectic, patients don't want to eat, patients are losing weight every day. In those scenarios, tumor necrosis factor or TNF is playing the pivotal role to decrease the appetite and promoting the anorexia of that patient. Okay, and weight loss, obviously. So next is effect is fibroblast, increased proliferation, increased collagen synthesis, increased activity of collagenase and protease, and finally the leukocyte effect, increase the cytokine secretion. So interleukin 1 as a most powerful or most potent interleukin it initiates the release of other interleukins too, namely 2, 3, 4, 5, 6, etc. So interleukin 1 and tumor necrosis factor. This is dorsal root ganglia. Okay. এটা পরে দেখাচ্ছি আবার মেডাল অবলাঙ্গাটা পেন সেন্টারে দেখ এন্ডোজেনাস পাইরোজেন্স টেম্পারেচার এখানে হাইপোথ্যালামাস ঠিক আছে কেমোকাইন ফাংশন অফ কেমোকাইন্স কি endothelial breakdown and recruitment of the leukocyte increases the protease or collagenase activity, so the extracellular matrix is being loosened or being weak. These leukocytes from approaching from this endothelial gap to the extracellular matrix. Okay, দেখতে পাচ্ছিস সবাই ছবি? This is neutrophil, integrin high affinity state, and integrin ligand, that is ICAM1. So, in the process of diapedesis, you have to memorize everything in your exam. Okay, because it is a very important topic to be asked in your exam. What is the acute inflammation mediator? What are the vascular changes? Short notes diapedesis or short note leukocyte activation and released chemicals. Okay, so this is a neutrophil. This is a process of acute inflammation. It rolls down in through the endothelial cell, and after binding this integrin, that ligand that present in the endothelial cells, this neutrophil eventually enters the gap between these two endothelial cells, and after with the effect of increased collagenase activity or increased protease activity, this leukocyte or neutrophil, whoever present within the lumen of the blood, after causing inflammation, it enters to the endothelial cell gap and enters to the extracellular matrix and releases various bactericidal enzymes. That will be also discussed later. Okay. So clear? Next is icosanoids, very much important. Why it is called icosanoids? It's a bit of organic chemistry class. Icosanoids are the derivatives of a 20 carbon containing molecule that is called arachidonic acid. Okay, arachidonic acid is a 20C or 20 carbon containing compound that is present within our body, and arachidonic acid is derived from the cell membrane phospholipid. Okay, so in the time of inflammation, with the function of converted to arachidonic acid. So it is evident that arachidonic acid is the chemical mediators of acute inflammation that is newly synthesized. Okay, previous ones were serotonin, histamine are preformed granules, but arachidonic acid and its metabolites are all newly synthesized or freshly synthesized at the time of inflammation, at the site of inflammation. Okay, so with the function of phospholipase enzyme, the cell membrane phospholipids that breaks down into arachidonic acid. So arachidonic acid is itself is more not so powerful than its metabolites. Okay, so two enzymes, here is phospholipases, so steroids inhibits in this area. So steroids are often commonly prescribed as anti-inflammatory drug. Okay, so what is the function of steroid? Steroids inhibit the phospholipase, and this phospholipase inhibits the formation of arachidonic acid from cell membrane phospholipid. So there is a downfall of the inflammation procedure. Okay, now arachidonic acid has effect of two powerful enzymes. One is COX, another is LOX, that is cyclooxygenase and lipoxygenase. Okay, very important short note. So cyclooxygenase pathway and 5-lipoxygenase pathway. So from the arachidonic acid, by the function of cyclooxygenase, prostacyclin and thromboxane A2. Okay, prostaglandin G2 or prostaglandin H2, these are precursor molecules. But the final two important mediators that are arachidonic acid or icosanoids or arachidonic acid derivative are prostacyclin and thromboxane A2. Prostacyclin is commonly written as PGI2, not PGI Chandigarh, PGI2, and thromboxane A2 is abbreviated as TXA2. Okay, thromboxane A2 and prostacyclin or PGI2 has contradictory effect or opposites function. Thromboxane A2 is a potent vasoconstrictor, is a very much important procoagulant, but prostacyclin or PGI2 is a potent vasodilator, is a potent anticoagulant. Okay. So, what are their functions? Thromboxane A2 functions vasoconstriction, promotes platelet aggregation, but prostacyclin inhibits platelet aggregation as well as it causes vasodilatation. The most important in cyclooxygenase arm is prostacyclin and thromboxane A2. Another is PGD2 and PGE2. Those are also involved in vasodilatation and increasing vascular permeability. So, starting from by the action of phospholipase, it involves the formation of an important 20 carbon molecule, that is arachidonic acid, and arachidonic acid has two enzymatic conversion or two enzymatic arms downwards. One is cyclooxygenase pathway, another is lipoxygenase pathway. So, we are being told the cyclooxygenase pathway in detail. Now, the lipoxygenase pathway or LOX, they are involved on production of leukotriene, LTC4, LTB4, LTD4. Okay, so leukotriene A4, C4, D4, E4, B4. So, leukotriene and lipoxin are derived from arachidonic acid by the function of LOX or lipoxygenase enzyme. So, the most powerful is leukotriene B4, LTB4, okay, and the functions are vasoconstriction, bronchospasm, increased vascular permeability, okay, and lipoxygenase or lipoxin A2 and lipoxin B, they inhibit the neutrophil adhesion and chemotactin. But our important short note will be icosanoids that must not exclude prostacyclin, thromboxane A2 and leukotriene. Okay, very important short note. সবগুলো লিখতে হবে and COX1 and COX2 inhibitor like aspirin, indomethacin, atorecoxib, celecoxib, these are COX inhibitors. So, COX inhibitor means cyclooxygenase enzyme inhibitor. So, whenever the medicine symmetrically inhibit the production of thromboxane A2 or prostacyclin. So, these are also used as anti-inflammatory drugs. Okay. Next is reactive oxygen species, danger. Okay. So, there is a production of danger molecule, and to neutralize the danger, we have in our body scavenger molecule. Okay. So, reactive oxygen species is a very potent tissue damage weapon of our body. Okay. Hydroxyl radical, superoxide ion, these are potent chemical free oxygen radical. So, after donating electron, superoxide after donating electron, hydrogen peroxide after donating electron, hydroxyl radical, and after hydroxyl radical with receiving electron is H2O. So, in this chart, only hydrogen peroxide and H2O or water is least powerful. Superoxide hydroxyl radical. These are important free radical or reactive oxygen species, and to neutralize these free radical induced injury, we have our scavenger mechanism, okay, name as glutathione peroxidase, catalase, and superoxide dismutase. So all these table more or less have contradictory effect containing molecules. Okay, so with reactive oxygen species also, there is a chance of damage, but if the body scavenging mechanism is to the full power, then this free radical will be neutralized. Okay, so the scavenger molecule is very much important, naturally built inherent antioxidant mechanism. Okay, so reactive oxygen species is another important mediators of acute inflammation. Next is nitric oxide. I told you earlier, nitric oxide is the most potent vasodilator ever known in our body. So nitric oxide is as a potent vasodilator. It involves invariably mediator of acute inflammation. Okay, so it is released by neutrophil, okay, and endothelial cells. And endothelial cells, this nitric oxide, they decreases the adhesion of the platelets and the dilation of the vessel smooth muscle. Okay, vessels have three layers. Okay, endothelial layer, muscular layer, and adventitial layer. Right? Endothelial layer has the bedding surface of the platelets and clotting factors. Whether a clot will be formed or a clot will be dissolved, that will be determined by the endothelial cells. And what are the function of the medial layer or muscle layer? That the muscle layer is the intrinsic capability to contract and to dilate. So the nitric oxide, it released from the endothelial cell, but it affects the medial layer. So the relaxation of vascular smooth muscle or vasodilatation occurs. Okay. Nitric oxide as a transmitter substance, not important for you. Next is leukocytic lysosomal enzyme, phagocytosis, leukocyte or neutrophil. Neutrophil is a most important antibactericidal molecule in our body, right? So neutrophil has various granules. One is primary granules or larger granules. Next is secondary granules. Primary granules, those are containing most potent bactericidal enzymes, namely myeloperoxidase, lysozyme, etc. And the secondary granules also involve or also secrete various enzymes. So this is a neutrophil. Neutrophil have 3 to 5 lobes. তাই তো এটা হচ্ছে কম্পাউন্ড মাইক্রোস্কোপ, লাইট মাইক্রোস্কোপে দেখা ছবি। আর এটা কি মাইক্রোস্কোপ বল? ইলেকট্রন মাইক্রোস্কোপ। ভেরি গুড। এরা গ্র্যানিউলস গুলো, the primary granules, they secrete various enzymes like neutrophil elastase, cathepsin G, myeloperoxidase, azurocytin, and protease 3. Okay, and the tertiary granules or secondary granules, they secrete enzymes like lactoferrin, lipocalin, lysozyme, and MMP8, MMP9, MMP25, etc. But the most important is primary granules or azurophilic granules. At these granules and these enzymes, like namely neutrophil elastase, neutrophil lysozyme, lactoferrin, then myeloperoxidase, these important enzymes that constitutes the NET or neutrophil extracellular trap. Okay, that trap or that sieve that engulfs the foreign body or the microbe or the antigen. Okay, so these are the mediator of acute inflammation released by neutrophil. Next is neuropeptide, substance P, and platelet activating factor. This is dorsal root ganglia, pain center of our body. Okay, substance P, is a mediator of pain. So it, from the nerve ending, this substance P, it sends the signal from dorsal root ganglia to the pain center of our brain. Okay. Plasma protein derived mediator. Okay. Plasma protein derived mediators are less in number. Okay. So important are complement and kinin. Complement তোমরা পড়েছো তো মাইক্রোবায়োলজিতে? এখনো পড়িসনি? ও তোরা তো সবে উঠেছিস নতুন। ঠিক আছে, complement system and coagulation system will be discussed later on. Okay, but most important complement system byproduct. Okay, that those are C3A, C5A, C4A. Okay, so complement system is a system that will be activated in 3 pathways: in classical pathway, in alternative pathway, or in mannose binding pathway or lectin pathway. Okay. So there are few byproducts of this activation and complement derived bacterial killing in our body, and these byproducts are C3A, C4A and C5A. Okay, the most potent is C5A. What are their functions? Contraction of the smooth muscles, increased permeability of the blood vessels, degranulation of basophils, chemotaxis, release of O2 radicals and lysosomal enzymes. So C3A, C4A and C5A are collectively known as anaphylotoxin because they initiate anaphylaxis. Okay, and among these anaphylotoxin, most potent is C5A. বোঝা গেল? Ultimately, this complements activation by various methods like alternative pathway, classical pathway. Ultimately, there is membrane attack complex is formed that is composed of C5B to C9. So C1, C2, C3, C4, C up to C9. There will be a long list of complements. Okay, you need to know. The microbiology teachers will be dealing that part. Next is coagulation and kinin system that will be dealt later in our hematology. Okay, but just for your knowledge purpose, this kinin and this bradykinin, that is an integral part of fibrinolytic system. This bradykinin has important function is pain transmission. So the pain transmission and the receiving of pain is important for mediating acute inflammation events. Okay, so coagulation and kinin system will be dealt later in hematology domain.